Hey everybody, Darren Reeves here, President DP Distribution and Consulting with another DP Minute. Here we are talking about comment number 44 of the QMSR preamble. It states, FDA received a comment asking that FDA remove the reference to clause 758 of ISO 13485. That's the identification clause. One commenter suggested that the reference to clause 758 seemed to require that organizations assign a UDI to products throughout the product development cycle, while Part 830 only requires UDI for finished devices. This comment also asked the FDA remove the reference to Part 821, which is medical device tracking regulation, in the proposed draft because the reference to Part 821 is confusing, as the commenter opined that traceability requirements in clause 7591 are not the same as requirements for device tracking under Part 821. So there's a lot going on there. We're basically talking about the tracking of devices and tracking of components, the identification of components, and the identification of finished medical devices. So here's what the FDA had to say. FDA disagrees with the comments' interpretation of the regulations and takes this opportunity to clarify its expectations regarding compliance with Parts 830 and 821 for the purposes of the QMSR. And so they go on in this particular comment number 44, they go on to explain some of the rationales to why they believe that they don't need to remove that particular section. The QMSR classifies the applicable regulatory requirements for UDI in 82010, which states that the system for assigning UDIs must comply with Part 830. So essentially they're referencing back to the other regulatory applicable documents. FDA does not consider the QMSR to require an organization to assign a UDI to devices under development because the provisions in Part 830 apply to a device in commercial distribution only. FDA also disagrees with a portion of the comment addressing compliance with 82010. FDA does not consider the reference to Part 821, which again is the medical device tracking, to create a general requirement that an organization's traceability procedures adhere to the requirements of Part 821 when it's applicable. So for those of you that don't understand what needs to be tracked and what doesn't need to be tracked, according to 21 CFR Part 821, that's not what you think it would be. It's only for critical medical devices, although the UDI does apply for all the medical devices. And we'll do another DP Minute on that one in the future. And that's it for now. We'll see you next time.